Hello and welcome to our program. Please join me in welcoming on our show today the well-known and highly respected homeopathy specialist, Dr. Lal Singh. Dr. Singh, welcome to the program.
Thank you.
Your relationship and your rishta with homeopathy, how did it start?
I selected homeopathy because it is gentle, polite, non-injurious, and it is fit to the every pocket.
Okay.
So my ambition was to serve the suffering humanity. So I selected homeopathy because out of my own income, I can serve the suffering humanity. And that I started homeopathy after taking DHMS
Right.
from the Nehru Homeopathic Medical College, New Delhi. And then I started the homeopathy on charitable basis. Working in the institute, having experience of the laboratory medicine and nuclear medicine, homeopathy treats the person as a whole,
Beautiful.
not only the one disease, because we picked up the constitution of a patient, mental symptoms. Every patient is having two symptoms. One is objective symptoms and then is selective symptoms. Selective symptoms are the symptoms of the patient which narrates. The objective symptom is of the physician
Okay.
who just, and keeping in view the similarity of the symptoms, and total symptoms are taken into view and then select the medicines.
That means if two people have a similar disease, the treatment might vary depending on
Yes, depending on the constitution of a person,
Okay.
habit of the person, dietary habits.
The person, the doctor asks, क्या अच्छा लगता है, ठंडा लेते हो, गरम लेते हो, mood कैसा है, and I think the detailed history is something very unique and
You see,
beautiful.
the third thing is modality.
Right.
The selection of the medicine comes with the subjective symptom, objective symptoms, and the totality of the symptoms.
Okay.
Every patient is having some categories. One likes sour things, one likes sweet things. The keeping in view the disease which should be prevented. And the selection of medicine will be on the modalities.
Okay. Right.
One patient is there who likes cold water. The another patient likes sour things.
Right.
So we have to select the medicines keeping in the modality of the symptom.
It's also a myth associated with homeopathy is that it takes very long to be effective.
No,
but there
not-
are so
not
many
at all,
things that
not at
homeopathy
all.
works like a miracle.
Not. In acute diseases, you will see the miracles.
Right.
And the chronic diseases, which are never cured by any pathy, then the only remaining pathy is the homeopathy. Homeopathy is the answer to the chronic diseases.
Right. So what are some diseases, and now we have so many lifestyle diseases, which homeopathy has the beautiful answer to?
To your beautiful remedies, just keeping in view this habit of the patient.
Okay. Right. So whether it's hypertension, diabetes, blood pressure,
Everything,
skin problems,
everything is
acne.
one is the primary steps are there, keeping in view the working condition of the patient, living condition of the patient, dietary habits.
Right.
So that makes the physician to know what type of medicine should be given.
Are there any areas जहाँ पर होम्योपैथी, एलोपैथी या आयुर्वेदा सब साथ साथ चल सकते हैं कि एक समय पे एक ही कर सकते हैं?
Homeopathy, according to the Mahatma Gandhi, he
Ji.
was the lover of the homeopathy, and he taken homeopathic only. So according to his thinking, homeopathy is just like the policy of, he has written his own book. Homeopathy is just like the policy of non-violence, which cures the things. So one at a time.
Okay.
But certain diseases are there. The patient is a diabetic, is taking hypertensive drug. We cannot stop it immediately
Okay.
till we become on the level of the medicine.
Right.
So in that way, supposing one person is taking steroid
Okay.
and he comes to the homeopath, we won't ask to stop it, we will taper it.
Because steroids एकदम हटाने से they can be
हटाने से
other- जी
immunity will be disturbed.
जी जी. Medicine में faith also plays a role. So does faith play a role in homeopathy? That do you have to have faith in a particular stream to be cured?
Faith is the only thing which cures the patient. If the patient doesn't have the faith on the homeopathy, he is never cured. One has to bring the patient on that level that the homeopathy works. Supposing if the patient comes with acute disease in children, because it is quite similar to the extreme of life, the children
Okay.
and the old age, because the immunity becomes low.
Okay.
We have to give the medicines which never disturb the immunity.
So small babies, and there are so many little issues, if they are treated right from the beginning with homeopathy, their immunity over their lifetime is better?
Yes, of course. Works better with the children
Okay.
because they don't have the anything from the diet. Their diet is only the mother's milk or the milk only.
Right, the little top feed that they get, right.
So that's why the homeopathy works better, because it's a pure Brahman.
As a practitioner of homeopathy, advise that if you're taking homeopathy, then trust it, have faith in it, and as per the doctor's advice, don't mix too many medicine streams together.
That is the exact thing. Homeopathy should not be given when I give any other drugs.
Okay.
Especially if the patient is addicted to some drugs. We have to taper it with the medicine. Supposing the tobacco chewing is there,
Right.
he cannot stop the tobacco, or he cannot leave the smoking. We have to bring with our own medicines
Okay.
so that he should not addict to those medicines.
So, you know, this, Dr. Saab, tobacco chewing, alcohol, smoking, addiction, and there are rehabilitation processes for this. Does homeopathy have a cure for this?
Homeopathy is having cure. We treat the drug addicts.
So, in terms of a person recovering from addictions, how important is family support?
Family support is much essential. He should be given a support so that he should leave it,
Okay.
either socially, and the most thing is that if a family objects to it, the patient will leave it.
Right, right. And I think somewhere this whole understanding that an individual is being treated, but a family also needs to be supported and treated together.
Family support is needed.
Yes.
I have treated some cases of chain smokers,
Okay.
not with the medicine, with the young children. पापा मुंह हटा दो, तुम्हारे मुंह से बदबू आ रही है. Definitely person feels that I should leave it.
So it's an emotional play also,
Yes.
that how do you get them?
In my own practice, I always needed is just family support is that. Family should object it.
You have a huge network of charitable institutions, and there is deep empathy in you. This relationship between how does one understand that whatever gift one has is meant for a larger disbursement or helping more people, this deep emotional empathy, where did it start, how did it begin, and what was the driving force behind this whole vision that you have for yourself?
Only
But
thing
right
is-
now we'll go in for a short break. When we come back, we'll talk about
Yes.
it. Right now, a short break. कार्यक्रम में आपका एक बार फिर स्वागत है। हम वेल नोन होम्योपैथी डॉक्टर लाल सिंह से बात कर रहे हैं। डॉक्टर सिंह, होम्योपैथी में चैलेंज क्या है, लोगों को कन्विंस करने में चैलेंज क्या है, क्योंकि अभी भी ये ऑल्टरनेट मेडिसिन काउंट किया जाता है, मेन स्ट्रीम तो अभी भी एलोपैथी मानी जाती है।
Homeopathy is a purely scientific system because it has been taken a birth from the Samuel Hahnemann, who himself was a well-known, well-qualified allopath.
Right.
But when he saw the side effects of the medicines, suddenly he developed an idea while he was treating one of the materia medica, named as Cullen materia medica. He was studying quinine, sanconabor. When he himself has taken sanconabor, he developed the symptom of the malaria.
Okay.
So then he came to the idea that if one thing is creating the same type of disease, why not it should be cured by the same?
And that's the principle.
And that is the principle.
Okay.
Let likes be treated by the likes. So he developed homeopathy in that way. And then he tried everything on his own and developed the symptom as of the disease. The disease symptoms and the medicine symptoms should be the same.
Okay.
To make the patient similar, one should be polite with the patient. He should be, medicine should be given on the non-injurious basis.
Okay.
If you cut the patient of the pocket of the patient of the same day, he won't develop the faith.
That is so beautiful. You know, one of the most beautiful things, Dr. Saab, is the rishta, the relationship that you can establish with the being or the person you're treating. And that's
in my clinic, I advise the patient, take the medicine. If you cannot afford, my charges are very, very less in Delhi.
Okay.
If the patient is not able to afford the medicine, I take the treatment, and even if you don't have the fear to come to my clinic, take the fear from me.
Okay.
And this I have taught to my students and my generation also, that it should be gentle and it should not be near non-injurious.
Right.
It becomes injurious when you cut the patient on the same day.
Right.
And the second thing is, if the patient needs the treatment today and you are giving the appointment for 1 week, in my clinic, no appointment is needed. You come to the clinic, until whole of the patients are not seen, you won't leave the clinic. Because my mission is, I am working on the Chark Someta, not for the self, not for the fulfillment of any earthly desire of gain, but solely for the good of suffering humanity. Those who sell the treatment of diseases as merchandise, they gather the dust and neglect the gold. We have come here to collect something. The gold which we will collect will go with ourself. Mukhujal sada sukhi. If the patient is treated well, you get the happiness.
Very true.
And the disease is from the within, not from the outside. Homeopath try to treat the patient from within, which nowadays is treated as an anxiety.
Okay.
Every patient is full of an anxiety. How to treat the anxiety? You have to bring the symptoms from the within to outward, from more important organ to the less important organs.
Right.
And if the total symptoms are cured, the patient is cured.
So that means you work on the body, mind and spirit.
Body, mind and soul.
Right. In fact, one of the challenges, Dr. Singh, is that when you go to a super specialist in allopathy, the kidney person, the kidney doctor will only care about the kidney. The heart specialist will look at the heart. And you said in the beginning, homeopathy
we
sees
treat the person as a whole.
Person.
As a whole.
Right.
Because all the symptoms are related. It is just like electronic circle.
Okay.
All the symptoms, the brain is the main governor. If you treat the governor, everything will be all right.
Setting all anxiety to rest.
Satisfaction is comes with the politeness, and definitely then the dietary substances are there.
Okay. So food plays an important role.
Because the nutrition plays a highly role to cure the patient.
Okay.
And in my practice, I have started the nutritional medicines also, which we prepare ourselves, just as the diet supplements.
And they're all organic based.
Organic.
No steroids, nothing at all.
Nothing. There is a conception with the allopaths, if some patient is cured, जरूर steroid दिए होंगे.
Right.
But I have got a patient who tell the patient, you are giving this steroid for the last so many years, and homeopath has given me 2 doses and I am cured. You have to pick up the symptom, peculiar symptom of the patient on the mental symptoms, because everybody is having some setbacks and anxiety, occupational damages.
Yes.
You have to care. It's the only homeopathy which cures all the things.
Right.
क्या करते हो, कहाँ रहते हो, कैसा खाना है. If the patient is living in the damp condition, he comes to you with the asthmatic symptoms or bronchial allergy. And if you ask the patient if he is living in the dampness, you have to select the medicines which will remove the side effects of the dampness.
Okay. Right. So you have to treat that bronchial asthma differently than a person who's living in a different environment
Yes.
differently.
Secondly, if the person is using perfumes,
Okay.
deodorant, he comes to you with the allergic bronchitis,
Okay.
you will have to advise him no dust, no smoke, or no smell. You have to select the medicines according to the profession of a person. If the patient is taking a coffee
Right.
and he comes to you that you don't sleep throughout the night, आप उसको कहेंगे काफी छोड़ दो, काफी तो वो छोड़ेगा नहीं मुझे. You will have to select the medicine which is prepared from the coffee,
Okay.
coffea.
Okay.
You give the coffea and ask him not to smell, not to take the coffee.
Okay.
He will leave the coffee.
Because that desire for coffee will be decreased by the
Decreased by
medicine. Okay.
According to the philosophy, रंज से खुगर हुआ इंसान तो मिट जाता है रंज. जिसको बहुत ज्यादा रंज मिल जाए वो रंज ही उसका इलाज है. रंज में चला जाए तो रंज गायब हो जाएगा. मुश्किलें इतनी पड़ी कि सब की सब आसान हो गई. He comes out from all the obstacles.
Right.
But if you just leave it कि नहीं मैंने तो obstacle में रहना ही है, तो obstacle नहीं दूर होंगे.
Right.
obstacle के साथ ही ऐसे मिल जाओ कि obstacle अपना दूर हो जाएगा.
आपके पास इतने सारे पेशेंट्स आते हैं एंड कहीं तो आपको कुछ 3-4 चीज़ें जिस तरह से हम जीवन जीते हैं, ज़िंदगी की लाइफस्टाइल, कुछ कॉमन थ्रेड्स नज़र आते होंगे कि दीज आर द मोस्ट कॉमन कॉजेज फॉर सो मेनी थिंग्स दैट आर एग्रीवेटेड. कुछ है, कुछ शेयर करना चाहेंगे?
द बिगेस्ट थिंग ये कलयुग के अंदर है डिजायर. बंदे की डिजायर्स ही इतनी बढ़ गई हैं कि वो डिजायर पूरी नहीं कर पाता. टॉलरेंस नहीं है. You ask the young children with the harsh word, tolerance is lost. दूसरे की इज्जत नहीं करते हैं, एहतराम नहीं है. These are the basic causes of the diseases which are not actually diseases. Those are the created diseases.
Okay.
Some diseases patient creates himself. In that way, supposing if the person comes to you with a super spirituality, homeopathy has got the medicines which are indicated only on the behavior of the person. In my experience, if you want to study the patient as a whole, you will have to create the relationship with the patient.
You also have many students, Dr. Singh, and you've been a student yourself over
Yes.
time of life and of homeopathy. Do you see a difference?
I'm telling you only one example.
Okay.
Doctor has written a timing of from 8 to 11. He will come at 9. आजकल का स्टूडेंट कहता है कि जाओ तो पेशेंट बैठे हो. पेशेंट शुड वेट फॉर द डॉक्टर. जहाँ की ओल्डन थेरेपी थी, डॉक्टर शुड वेट फॉर द पेशेंट.
Yes.
दूसरा ये है कि एवरीबडी इज ईगर टू अर्न मनी with the profession. Recently, the recent theory is when the patient who comes to you, you charge the registration fee on the same day, give an appointment not less than 1 week, and you charge the consultation charges, registration fee, consultation charges, then the cost of the medicine.
So the patient comes under stress anyway.
मैंने अपने बच्चों को भी स्टूडेंट को ये सिखाया है कि भाई ठीक है, गो फॉर द मिनिमम चार्जेस विच आर नीडेड फॉर यू, because according to the great physicians of the olden ancient time, thy cures the patient and doctor charges the fee. You are treating a patient from the whole artery, definitely he will be cured. But if you charge heavily any amount of thing,
You know a lot of allopathic doctors also. Do they also send patients to you?
even today, a lot of the patient allopathy come to me,
Okay.
and they come to the conclusion where allopathy fails, homeopathy begins, and the two with Dr. Lal Singh.
Okay. All right.
So this is the reward which I am getting from the allopaths.
You've also been given so many awards and recognition, and I think a lot of people want to understand. I think the word charity takes a different tone, because charity is like giving away. You don't give away, you share, and you share a part of yourself also. That is so beautiful. What does award and recognition mean for you?
Only the blessings of the patients. Awards are given by the organizations or by the Delhi government. But the biggest reward which I am getting is my popularity.
And reverence, and there's so much of love. I mean, everybody who speaks of you speaks with so much of love.
If my services are recognized by someone, that's the biggest reward.
Okay.
The reward by the paper or by the things, it doesn't work.
You know, we're really struggling, Dr. Singh, with our health system and the health services, because the population is so huge, and modern medicine, which is allopathy, is the primary one that we're trying to take everywhere,
Yes.
and we're really struggling as a nation. What do you think we can really do to bring in, to actually make good health options and disease-free options for people at large, easily and more cheaply?
People are practicing, most of the diseases are the self-treatment. The patient take the self-treatment,
Okay.
which should be avoided.
So self-medication, which we call.
Self-medication should be
Okay.
avoided.
Okay.
And I always recommend to the people that जिसने आपको बचपन में ट्रीट किया ना, सबसे पहले उस डॉक्टर के पास जाओ
क्योंकि वो आपको जानता है,
जो आपको जानता है.
अंदर से जानता है.
आजकल क्या है, एवरीबॉडी वांट टू गो टू द स्पेशलिस्ट.
Right.
Specialist will only cure the one portion, but the person who is treating you right from the childhood, he will know what are your habits, what the medicine he has given to you, and what are the other things. Homeopaths are quite unfortunate in that way, because the homeopathy taken as a lot. At the last, when person tries each and everything, then वो फिर होम्योपैथी की शरण में आ
मतलब जब कुछ एलोपैथी नहीं काम कर रही, या इवन आयुर्वेदा नहीं काम कर रहा, तो होम्योपैथी के पास आ जाओ.
अगर होम्योपैथी में बात पहले से आ जाए तो डिजीज को हम एक्यूट स्टेज से क्रॉनिक स्टेज में जाने ही नहीं देंगे.
ओके.
अब बच्चों की आम प्रॉब्लम है एडिनाइड्स एंड टॉन्सिल्स.
जी.
वो 6 साल तक कोई भी अच्छा डॉक्टर उनको ऑपरेट नहीं करता. उसको अगर होम्योपैथी से ट्रीट किया जाए तो उसको ऑपरेशन की जरूरत ही नहीं पड़ेगी.
सो कौन सी ऐसी चीज़ें हैं, 2-4 अगर आप नाम ले, समथिंग एंड आवर व्यूअर्स कैन सी, कि अगर उनकी फैमिली में कोई है बच्चे में इशू, तो वो अभी से होम्योपैथी ट्रीट कर लें?
द बिगेस्ट थिंग इन द चिल्ड्रन इज टॉन्सिल्स एंड एडिनाइड्स.
ओके.
बिकॉज बच्चे जो हैं जो चीज़ है मुंह में रखेंगे, जो चीज़ उठा ली वो मुंह में डाल ली, है दैट गोज टू दी टॉन्सिल्स एंड एडिनाइड्स.
इसके सिम्टम्स क्या होते हैं कि बच्चे को टॉन्सिल्स है या एडिनॉइड है?
बच्चा हर वक्त बीमार रहेगा, खांसी रहेगी, एडिनाइड्स हैं,
ओके.
माउथ ब्रीदर हो जाएगा,
अच्छा, नाक से सांस नहीं लेगा,
नाक से
मुंह
सांस
से
नहीं
लेगा.
लेगा. देन ही विल बी, इम्यूनिटी विल बी लॉस्ट,
जल्दी जल्दी बीमार
जल्दी
पड़ेगा.
जल्दी बीमार होगा.
ओके.
पेट की बीमारियां होंगी, वॉर्म्स हो जाएंगे पेट में, क्योंकि एवरीथिंग गोज थ्रू द टॉन्सिल्स.
ओके.
टॉन्सिल से जो सलाइवा निकलेगा वो जाएगा, इंटेस्टाइन्स को खराब करेगा. So these are the children diseases. The most advanced medicines
ओके,
गए एंटीबायोटिक दे दिए, सुप्रेस हो गए,
हाँ जी,
एंटीबायोटिक से साइड इफेक्ट्स हो गए,
बिल्कुल,
बच्चे का पेट खराब हो गया। तो उस जमाने में अगर वो होम्योपैथी में आए तो साइड इफेक्ट्स ही होंगे,
जी, और जल्दी से ले सकता
जल्दी
है,
से ले
नॉन
सकेगा।
इन्वेजिव है जी।
और जो हमारी स्वीट पील्स हैं वो बच्चे खाते ही स्वीट पील्स हैं।
हाँ, खुशी से खाते हैं। सो वन इज दिस, द अदर थिंग डॉक्टर साहब, बड़े सारे दे आर स्टमक इश्यूज, यू नो, यंग चिल्ड्रन ऐसा कुछ भी मुंह में डाल लेते हैं तो पेट खराब रहता है, एंड यू नो समटाइम्स इट कैन गेट वेरी, सो व्हाट इज सम गुड होम्योपैथी ट्रीटमेंट? उसके लिए भी जो दवाई हैं फॉर द डाइजेस्टिव सिस्टम आर नॉट वेरी स्ट्रॉन्ग।
ऑफन द चिल्ड्रन आर हैविंग ए चिल्ड्रन डायरिया, ग्रीन डायरिया जिसको बोलते हैं।
जी,
द ट्रीटमेंट इज ओनली विद द होम्योपैथी,
ओके,
नॉट विद द एंटीबायोटिक्स। एंटीबायोटिक्स दोगे तो स्टमटाइटिस हो जाएगा, मुंह में छाले पड़ जाएंगे।
होम्योपैथी ट्रीट्स एस्मा आल्सो
होम्योपैथी ट्रीट्स इट टोटली क्योर,
एंड कंप्लीटली,
complete cure.
ओके,
But it takes time because we will have to, at least in my practice, I give the treatment for 1 year.
ओके,
All the 4 seasons to bring up the immunity up to the level of the disease.
एंड व्हाट अबाउट थिंग्स लाइक डायबिटीज, ब्लड
Diabetes
प्रेशर?
only, you see, the prevention is also there, diet is also there, physical exercise is also there.
So along with that, homeopathy can treat all
Yes.
this.
The person is on the insulin, immediately we cannot stop the insulin.
Right, right.
In young children, you see the infantile diabetes, you cannot give the medicines. First you have to check the level of the insulin in the body, and for that you cannot stop the insulin,
Okay.
but you give the side treatment.
And you wean them off.
Yes.
Wonderful. I think somewhere in our heads also this whole concept and the myth breaking of where we can use homeopathy and go there and allopathy, you're weaning us off a lot of our myths also.
People are giving good awareness of the homeopathy,
Yes.
and
yes.
all the educated people, they prefer homeopathy.
And that shows why there are so many long lines also
Yes.
outside clinics, including yours. But thank you so much, Dr. Singh, for
Thank
coming
you.
on to our show. Thank you so much.
Thank you. Thank you.